Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Doctor, what are the signs of hearing loss?
In children, you'll be looking for speech or language delay or inconsistent responses to sound. For school-age children, you'll be looking for concern of inattentiveness in class. In adults, any difficulty hearing in background noise, difficulty understanding what people are saying, as well as in the elderly, you're looking for increased confusion and withdrawal from social situations.
How common is hearing loss?
We're seeing hearing loss much more or much earlier now than we were years back. In the state of Massachusetts, newborns are now screened for the hearing loss prior to discharge from the hospital. So we are identifying more children with hearing loss right after birth versus years back when we were not identifying them until they had trouble in school, so around 5 years old. In adults, even teenagers, we're noticing more hearing loss because of the noise levels that they're listening to their music with. Adults, I think that we're starting to make progress in occupational noise exposure, so making sure that if you're working in a loud environment, the employer provides hearing protection for you. And then in the elderly, it's very common to see hearing loss as you age as well. So I think people are becoming more aware of the dangers of hearing loss, and some of the research has been pointing to early onset of Alzheimer's with untreated hearing loss. So I think that a lot of people are becoming much more aware of it and starting to advocate for themselves and come in earlier for hearing evaluations.
When is it time to see a specialist?
Anytime that you have concern about your hearing or the hearing of a family member, you should see a specialist.
How is hearing loss tested, and what are some of the technologies used?
So depending on the age as well as the ability of the patient, we would put sounds through earphones or through speakers and look for a response from the patient. There are several different treatments for hearing loss. If we feel that the hearing loss could be caused by a medical problem, we will refer the patient to an ear, nose, and throat physician first. If we find that the hearing loss is not treatable through medical means, the most common rehabilitative option would be a traditional hearing aid. For some patients, there are implantable devices that are appropriate, such as the bone-anchored hearing aid or a cochlear implant, and that is all based on the type of hearing loss that the patient has, as well as the severity of the loss.
Are there certain noises or elements that can cause hearing loss?
There are. So one of the most common that we're seeing now is noise-induced hearing loss due to loud levels of music or loud levels of environmental sound. So people who are wearing their earbuds in their ears and the music is at an excessive volume. Consistent exposure to any type of background noise, construction work, factory work, dental drills, patients who have been in the military, so around explosions and gunfire, that have not consistently worn hearing protection. Any type of trauma to the head sometimes, a skull fracture or sudden hearing loss, motor vehicle accident, those are all elements that can contribute to hearing loss as well. There are children that are born with permanent hearing loss, and many times we don't know what the cause of that hearing loss is. There are times that it is genetic, but the majority of the time we're not sure what has caused that hearing loss.